So thank you all for coming out today. I just want to take 5 or 6 minutes of your time and then be happy to answer some questions. Tell you a little bit about myself and why I'm running. So my name is Nasser Hanna, and I'm an oncologist at the IU School of Medicine. I'm also the co-founder of a nonprofit organization that serves school children throughout the state. My wife Amy and I live in Fishers. We've been residents there for 11 years, and we have 3 children. Like many of you, I have long been frustrated by what I see out of Washington. What we see in Washington oftentimes is very disconnected with what's going on in our everyday lives, the rhetoric that we hear and the infighting that we hear. I come to think that many of our public servants have lost sight of who they work for and what the meaning of public service is really all about. Rather than sit on the sidelines and complain about this, I decided to do something about it, something I never thought that I would do. So on Monday of this week, I filed my candidacy for the U.S. House of Representatives in Indiana's 5th Congressional District. I'm running for Congress because I want to bring responsible leadership and some new ideas to the voters of Indiana. I have new ideas that can return some prosperity to our district. I have new ideas that can take Hoosiers back to work. And I have new ideas that can help struggling families afford health care and education. The question is, what would I prioritize? You can't do everything you want. So if I were lucky enough to be elected and to carry your voices to Washington, what would I do? Well, first of all, I think we're entering a new economic period. We had previously gone through the industrial age, and then we went through the information age, and this is where the jobs were. We're now entering an energy age, and whoever controls the energy age is really going to control the world's marketplace. And I believe that we have to take the lead in the energy age. So as a responsible leader, I'm going to put green technology at the top of our agenda. If we invest ourselves deeply in green technology, I think that will result in thousands of new, high-paying jobs here in Indiana. Secondly, as our economy recovers, and it will recover, we're going to need to put some fiscal accountability back to our federal government. It was necessary to invest deeply during the hardest hit times last year. But our economy will start to recover, and now we have to refocus ourselves and ask us, what do we hold as a priority? The responsible leadership that I'm going to take to Congress is going to focus on just that. But I have to warn you, part of responsible leadership means making really hard choices. And it means reforming the 4 largest spending programs in our federal budget. Those 4 programs are Social Security, Medicare, Medicaid, and defense spending. If you add the interest of our national deficit on that, those 5 things comprise nearly 80% of all federal spending every year. The other 20% is discretionary spending. Now, this is political terrain that very few politicians dare to tread. But we are going to have to address these issues if we really want to get our fiscal house in order. In order to do this, we have to prioritize what we want to do as a country. And I think we should focus on 4 things. First is our economic security, so that we can be leaders in the global marketplace, so that we can have those good jobs. We have to invest in our workers. We have to invest in new technologies. We have to invest in education. These are short-term investments that will pay huge dividends in the long term. Secondly, I believe we should have health security. Nobody should have to worry about getting sick and having unaffordable medical bills on their hand. So we need health security for all Americans. The current health care bill in Congress does a lot of nice things to reform some of the abuses of the health insurance industry. But there are a couple of things that it does not do. I do not think it controls health costs enough. And I also don't think it takes advantage of our best insurance program to cover more people, and that's Medicare. Medicare, to the surprise of many, is actually the most efficient, most effective health insurance program that exists. Medicare has 2.5% overhead. When you pay your Medicare taxes, 97.5% of all those taxes goes to medical services. 2.5% goes to running the program. In contrast, the Medicaid system is federal dollars that go to states. States run the programs differently, and those programs are oftentimes not the best run, not the most efficient, and they're oftentimes very much underfunded. So I would suggest that we focus more on expanding Medicare eligibility. The third priority that we must have is, we talked about economic security, health security, retirement security. Social Security is probably the best social program in the history of our country. And that is something that Democrats should be very proud of. And we should continue to invest in our Social Security program. The fourth, of course, is our national security. Those should be our priorities. Now, beyond that, we probably are going to have to reduce spending in many other federal programs. And we're probably going to have to return some of these responsibilities back to the state. We simply can't do everything at the federal level. By prioritizing in this way, I think we'll have a more effective federal government. And I also think we'll be in line with the principles of our founding fathers.